Government launches National Lists of Essential Medicines (NLEM) 2022. Know all about it. The Union Health Ministry recently released the new National List of Essential Medicine (NLEM-2022), revising it after a 7-year period. The new list, issued on September 13, has included more cancer medicines, newer diabetes drugs, and even 4 drugs that are under patent. What is the National List of Essential Medicine? Curated by experts in consultation with stakeholders, the list includes medicines that are needed to address the priority healthcare needs of the majority of the population. The drugs included are those that are best for the treatment of a particular condition and are cost-effective at the same time. This is the reason the list almost always sees the inclusion of generics, unbranded medicines, like paracetamol instead of Crocin. The list usually includes medicines that are a part of government's health programs, such as Badaquiline, included in the 2022, that is used in the country's TB elimination program. When was the list made? Framed on the principles of the World Health Organization's Essential Medicine List, India's first list was developed in 1996. It has since been modified 4 times, in 2003, 2011, 2015, and now in 2022. The revisions are done keeping in mind the changing profile of diseases in the country, newer drugs becoming available in the market, drugs becoming obsolete or being banned for certain risks, and newer treatment protocols. The most important use of the list is to make these medicines affordable to the general population. How does the list make the medicine affordable? The government has the power to control the prices of certain medicines, those needed in public interest, through the Drug Prices Control Order. The National List of Essential Medicines forms the primary basis for considering a drug as essential and controlling its prices. Once a drug is included in the NLEM, its prices are controlled by the central government and cannot be changed by companies themselves. Based on this list, the NPPA will decide the ceiling prices. The prices of medicines under the NLEM cannot be increased by the companies themselves, but every year the prices are increased or decreased as per the wholesale price index, meaning the prices of these medicines cannot be increased unreasonably, Union Health Minister Dr. Mansukh Mandavia said during the event to launch the list. Addition to the list of 2022, the new list has added 34 medicines that were not in the NLEM 2015. Most significantly, it has added 4 cancer medicines, bendamustine hydrochloride, that used for treating certain types of blood and lymph node cancers, irinotecan HCl trihydrate used for treating colorectal and pancreatic cancers, lenalidomide for treating various types of cancers, and leuprolide acetate for treating prostate cancer. Cancer therapies are usually very costly but also have higher trade margins. The list has also included newer class of drugs that are now routinely used for diabetes management by doctors, the medicine teneligliptin and the insulin glargine. The rotavirus vaccine, which is now a part of the government's universal immunization program, has also been included. Importantly, the list has also included at least 4 drugs that are still under patent, such as Badaquiline and Delamanid for TB, dolutegravir for HIV, and daclatisvir for the treatment of hepatitis C, all of which are part of government's national health programs. Debate over addition of patented drugs. This is the first time that patented drugs have been included in the list, as these drugs usually cost more. A question is raised time and again whether patented drugs should be included in the NLEM. So, the committee, as well as the stakeholders in the ministry, took the decision that patented drugs can also be a part of NLEM if they fulfill the criteria of need, safety, efficacy, and cost-effectiveness. And these medicines are very important and should be a part, said Dr. Yag Gupta, who heads the Standing National Committee on Medicines that was set up in 2018 to modify the list. Removal from the list of 2022. There were 26 drugs that were deleted from the previous list, bringing the total number of drugs in the NLEM 2022 to 384. The most significant deletions were 3 anti-tubercular drugs, including kanamycin injection that was used in patients with drug-resistant TB. Besides, with the government now introducing an all-oral regimen for such patients, the drug was also associated with severe side effects such as kidney problems and hearing loss. While adding antibiotics like meropenem and antiparasitic ivermectin, which is also a part of the government's lymphatic filariasis program, the list has deleted antimicrobials like capreomycin, ganciclovir, that is known to be a carcinogen and lead to embryo malformation, and a hepatitis medicine with poor efficacy. Petroleum jelly and bleaching powder have also been removed from the list.